Swadikap and good afternoon once again. Today is Friday, the 23rd of April, 2021, and this is the English language summary of the daily press briefing here at the CCSA. So first of all, just to highlight first that we have a new high number of new confirmed cases at 2,070. 2,070 cases is a new high because in the past days and weeks we had the mid thousands, meaning 1,003, 1,005, 1,007 per day. But today our new high surpasses 2,000, 2,070 as you see in the blue box on screen right now. And of this number, 1,902 cases, the majority actually are from local transmission, 160 cases from active case finding and 8 cases from state quarantine. You may notice that from the very beginning, since last year until now, we have now reached cumulative number of cases ever since 2020 until today, over 50,000 cases now. However, comparatively, comparing to our population, over 60 million, almost 70 million, the majority of people remain safe from COVID. However, the risk is applied to everybody. Although 50,000 out of 63 to 65 million people is a small number, but the risk remains high. At the moment, we have active cases still being treated in hospitals, field hospitals, hospitals. This number stands at 19,873, as you see on screen. We have 4 new fatalities today, making the total fatalities now standing at 121. And I'll go into some detail of the 118th fatality to the 121st fatality. 118th fatality is a 72-year-old male from Bangkok with a history of visiting Phuket province. The 119th fatality is a 74-year-old male from Songkhla province with pre-existing conditions such as high blood pressure, cardiac arrhythmia, and previous contact with infected person. The 120th fatality is a 29-year-old woman in Bangkok with obesity and a history of contact with an infected person. The last for today, 121st fatality, is an 83-year-old male who had diabetes, was on a ventilator, high blood pressure, chronic kidney disease, heart disease, and previously contacted an infected person. So our sincere condolences to the families. You may notice that the 4 fatalities today, 3 of them are quite aged, the elderly, 72-year-old, 74, and 83. So more observations from the cases that we have for today. Firstly is that in Bangkok there is a new but small cluster outbreak in elderly care nursing homes. 3 cases reported so far, and in these nursing homes, a nursing assistant was infected with COVID. All employees and residents of these homes were getting tested and awaiting results. Now, this is a high risk because, as we have mentioned quite often, those who are in the elderly age group are more prone and more at risk, more susceptible to COVID infection. And if this small new cluster in Bangkok involves elderly homes, elderly care homes, it is something that is of a serious situation that we have to look into. Another cluster, small outbreak, is in Chiang Mai, in the meditation venues, meditation activities in this cluster. And the top 10 provinces that we found new COVID cases for today are as follows. Bangkok, up to 740 cases today. Chiang Mai, 237. Chonburi, 125. Samut Prakan, 79. Nakhon Ratchasima, 69. Samut Prakan, 48. Prachuap Khiri Khan, 44. Pathum Thani, 41. Surat Thani province standing at 38 and Rayong at 35 cases. Now the CCSA daily meeting this morning, chaired by the Secretary General of the National Security Council, talked about some very important issues regarding the hotlines and the hospital beds availability. And I'll talk a little bit about that here. Firstly, as you know, there are three main hotlines for those who have been found infected with COVID and need medical advice, and also to request to be placed into field hospitals or hospitals because of the availability of beds is something that we are currently managing. Now, these three hotlines, in the meeting that we had this morning, there had been lengthy discussions on coordinating between the three hotlines to improve the capacity of the three hotlines, and that has been done already since yesterday, improving the number of people receiving phone calls in the hotlines, as well as the coordination between the three hotlines in order to refer to hospitals in the network of the various hotlines so that hospital beds can be put into good use. Now, for the use of hospital beds, the general idea now is that we will be pooling the various hospital beds using all the beds available. We are also planning ahead, especially for hospital bed needs in Bangkok, the Bangkok Metropolitan Administration hospitals. Currently, there are still enough beds in the BMA hospitals for around 3 weeks ahead, but those will be increasing in due course. And of course, the integration of the use of all the beds available from the three hotlines, that will be improved as we speak. So moving on to just some, some observations regarding the situation that we have here. An interesting analysis from the former permanent secretary of the Ministry of Public Health, Dr. Sopon Mekton, regarding the COVID cases in Thailand. That Thailand is actually able to avoid a 40% increase in the number of cases, especially those of the British variant, due to the strict measures implemented during Songkran. In the next 1.5 months, it's predicted that the number of daily cases will continue to be high, around 1,800 new cases or more until next week, at least. If all preventive measures continue to be implemented, we will be able to reduce the number of daily cases. He also reiterated that all positive cases, be they severe or not, will have to be hospitalized in hospitals or in field hospitals so that the cases are properly taken care of to avoid fatalities at home, like in many countries that have only the home quarantine system, many other countries. And this is because of the lack of the insufficient medical attention when people are home quarantined. Dr. Sopon also urged that those who have been infected should disclose whereabouts to medical personnel to fight against further transmission. And we talked about this quite often in revealing the information and timeline if you have been infected with COVID. That's very, very important. Now, on some other issues, just to touch briefly on other issues, and Dr. Tuisin had mentioned this in passing in the Thai language edition as well, regarding the Sputnik 5 vaccine of Russia. Now, the Prime Minister Prayut Chan-o-cha, had revealed that the President of Russia had agreed to supply Thailand with Sputnik 5 via G2G contract, government-to-government contract, following talks between the Royal Thai Embassy, the Thai Embassy in Moscow, with their Russian counterparts. And the Ministry of Public Health will engage in further talks with the representative of Sputnik vaccine in Thailand, and details will be finalized in due course. So the Ministry of Foreign Affairs, through the Royal Thai Embassy in Moscow, had spearheaded this discussion with the Russian side, and the Ministry of Public Health of Thailand will continue engaging in the further talks to acquire more vaccines at the earliest opportunity. At the policy level, the Russian and Thai governments have agreed to work on procuring these vaccines from Russia to Thailand. At the policy level, that's been agreed, and details to be finalized, of course, in due course. There's an infographic there on the social media page of the Prime Minister. It's in Thai, but I had recapped that in English just now for all of you. Now, another issue is on compulsory mask wearing in more provinces. More provinces have ordered people to wear face masks in public, having a fine of up to 20,000 baht in accordance with the Communicable Disease Control Act. And these provinces include Surat Thani. I mentioned Surat Thani yesterday, having these fines. Surat Thani, and it now also includes the provinces of Kanchanaburi, Yala, Trang, Narathiwat, Pattani, and Songkhla. So province-specific measures in fining people, in giving penalties to people who violate the order of wearing masks while in public. Now, just now we talked about field hospitals. I'll touch a bit on hospitals for patients with severe symptoms. So in Bangkok, the authorities are planning to establish more hospitals for patients with severe symptoms and reduce overcrowding at public and private hospitals, which should be focusing on treating more severe cases. So for the BMA hospitals, that would be for patients without severe cases, severe symptoms, while those with severe symptoms, of course, to the public and private hospitals. So the BMA now screening hotels that will take in patients from hospitals under the BMA to make sure that they are well equipped and safe for patients and staff. And hotels interested in becoming a hospital can contact the Division of Environment, in their district office in Bangkok. Yesterday, we talked about the Immigration Bureau, advising foreign nationals who have to report their residences every 90 days to do it by post as one of the means. Now, just one good development update on this is that the Immigration Bureau has announced that its online service for this 90-day reporting for foreign nationals and notification to foreign nationals is now operational. They have resumed a normal operation of online services, as you can see on the infographic on screen just now. Now, the Bureau has also notified that its service center for short-term visa extension is the tourist visa and special tourist visa will be moved from the Muang Thong Thani office to the government complex on Jang Watana Road. I'm sorry, this has been moved already. So this is information for you who have not been informed of this yet. Towards the end of the presentation, Dr. Tui Sin took some questions which were posed to him by the local media. One of the questions is that since we have a new high of 2,070 cases recorded for today, is that an issue of high concern? Is that an issue that we have to look deep into? How will we address this issue? Of course, the answer is that it is of high concern. We hope for the general public's cooperation, continued cooperation, so that the numbers, as I mentioned in the beginning, will go down, be on average 1,006, 1,008 per day, and then lower in the coming days and weeks, in the 2 weeks to 3 weeks ahead from now. We hope that that will happen. A question posed after the public and the media had heard about 2,070 cases is that where, so to speak, is the end of the tunnel? Where is the ends of this? Now, the authorities are looking very closely at new measures on what can be done, especially in terms of treatment, in terms of the hospital beds. Now, if the number of cases continue to increase in the 2 weeks, towards the end of this month, that's 1 week from now, or in the 2 weeks from now, or in the month and a half from now as benchmarks, if they continue to increase and the cases become more severe, we are looking towards expanding the ICU units, intensive care units, and field hospitals that can take care of ICU patients with severe cases. ICU expansion is one that is approved, and we will be putting that into practice in the various, in terms of the infrastructure and facilities to care for ICU patients with severe symptoms and positive from COVID. Now, first to do that, to expand on this, would be Ratchawiti Hospital in Bangkok. They'll be looking in terms of expanding the ICU capacity of that hospital, as it is the main hospital under the management of the Ministry of Public Health. And of course, to prepare for any unforeseen severe situation, this will also be a principle that will be used, applied to other hospitals around the country in due course. But hoping that we will not see higher number of cases in the days and weeks ahead, hoping that we will not have severe cases to the point that ICU facilities in hospitals have to be expanded and perhaps take the place of the other sections of each hospital, and that ICU beds that can care for ICU patients will not have to be expanded, because hopefully we will not be reaching that point. But in any case, if we do, this is the plan looking ahead. So there's light at the end of the tunnel, if that's so to speak. If that the question was, what do we do from here? I mean, how do we address this increasingly fluctuating number of cases? So hoping for the best, and hoping that all of you, as the general public, Thai nationals and foreign nationals here, will continue to keep Thailand strong. Let's hope for the best. Thank you for your attention, and see you next time. สวัสดีครับ
ครับขอบคุณนะครับท่านณัฐภานุนพคุณนะครับรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะครับและทั้งหมดคือการแถลงข่าวจากสบคประจำวันนี้นะครับสำหรับรายการ 14 นาฬิกาวันนี้ MBT รวมใจสู้ภัยโควิด -19 แอดทำเนียบรัฐบาลมาเจาะลึกมาคลายข้อสงสัยกันกับเรื่องของฟ้าทลายโจรครับว่าจะสามารถป้องกันและรักษาโควิดได้จริงหรือไม่นะครับบ่าย 2 โมงวันนี้กลับมาพบกันอีกครั้งนะครับสำหรับช่วงนี้ผมสุพนันท์ ฤทธิ์มนตรีพร้อมทีมงานทั้งหมดลาไปก่อนนะครับสวัสดีครับ